The first signs of a return to normalcy at the country's biggest referral hospital. The patients are trooping in, and unlike the situation for the last 3 months, they are being received and treated by doctors who only returned to work this past weekend. Their presence here confirmed by the man in charge of the health ministry.
Wagonjwa 901 kwa sababu wameanza kuongezeka hapa katika mahali wanaona magonjwa mahututi, waliona 141 jana na wanaendelea kuja. Kwa hivyo ni vizuri kwamba madaktari wamerudi.
While the patient numbers are not yet where they usually are, the ministry says the manpower here is still below par.
So the casualty where we have been, the management requires 35 medical officers. They have 14 in their employment.
But this situation is set to change soon. The coming of 500 doctors from Tanzania in the country will address this shortfall, not just at KNH, but at the county and faith-based hospitals around the country.
Our ratio is 1 to 6,000, and we want to go to 1 to 1,000. And we have absorbed all the doctors, those who are willing to work in the public sector. Then it behoves us to look for that skill.
The first batch of foreign doctors are expected in the country as early as 1st of April this year, and the government says it is looking even beyond Africa to show up its numbers in this critical sector. Beyond the 500 Tanzanian doctors, the country is also in talks with Cuba to get specialist doctors to work in Kenya.
Pursue that, especially to get specialist doctors who can work in certain fields where we have gaps of training, where we are training our people. As you know, now we have got cancer care and many other aspects. That is the latitude we are using as far as Cuba is concerned, so that we can have some professionals helping us as we train our own people.
The move to hire foreigners has been criticized earlier by the KMPDU, who insisted that the government hire 1,400 doctors it claims are unemployed. The CS disputes this.
Anybody trying to create an impression in the Kenyan mind that we are bringing foreign doctors when ours are in the streets, that's an absolute lie. Any doctor in this country who is in the streets is by choice.
The government has also denied that it is flouting the Public Service Commission Human Resource Manual that prohibits the hiring of foreign labor if the country has the same skill set. Foreign doctors will serve 2-year contracts. Brenda, Wanga, NTV.